Hi, it's Patrick Hutzel from intensivecarehotline.com with another quick tip for families in intensive care. So today's question is about, should you do a tracheostomy after COVID-19, ARDS or lung failure, ECMO and a cardiac arrest? So that's sort of a 3 to 4 step question I'm going to answer today, so stay tuned. So currently we are working with a client who has been diagnosed with COVID-19 about 30 days ago. The client ended up in ICU, initially on a ventilator because of respiratory failure, went into ARDS, also known as lung failure, ended up on ECMO, which is basically taking over the functions of the lung for a period of time so the lungs can rest and heal. When the client went on ECMO, he had a cardiac arrest and he potentially sustained a hypoxic brain injury from the cardiac arrest because his brain was potentially starved from oxygen during the cardiac arrest. So now, about 30 days later, he's off ECMO, the lungs are slowly recovering and he's not waking up, and EEG and the MRI has actually shown that there is most likely brain damage, and his Glasgow Coma Scale is about a 4 or a 5, and he's not waking up even though he's been off sedation for about 12 days now. So the question now that the family is struggling with is, should they do a tracheostomy? Should they give him more time to wake up because he can't come off the ventilator yet, and he may never be able to get off the ventilator, and with a potential brain injury he probably will need a tracheostomy for the rest of his life because he won't be able to swallow, and if he can't swallow without a tracheostomy he'll end up with secretions in his lungs and he ends up with another pneumonia. So if the family wants to give their loved one time to wake up and, not to die, they should be asking for a tracheostomy that would give him time to wake up. Now, there's no guarantees, of course, but the alternatives are pretty grim, and the alternatives would be to remove the ventilator and basically let nature take its course, or even hasten death with sedation such as morphine or midazolam or fentanyl, and that is could potentially be perceived as euthanasia. So they are very tricky questions to be asked, but in order to save a life and give the loved one more time to wake up and potentially recover, go to a neurology rehab, a tracheostomy would be the natural next step. That is my tip for today. And also, very quickly adding on to this, especially with services now like intensive care at home, with a tracheostomy, patients can go home and leave intensive care and have intensive care at home as well. So there are options and alternatives for situations like that, as long as you as a family agree on those steps. So that's my tip for today. Comment down below what you want to see, like my YouTube channel and subscribe, like this video and subscribe to my YouTube channel. If you have any questions, contact us on one of the phone numbers on the top of our website, intensivecarehotline.com. And thank you for watching. This is Patrick Hutzel from intensivecarehotline.com, and I'll talk to you in a few days.